this where you just see 2 or 3 people. Though late, we started late, but at the end, it justifies the means. And I can boldly say that I'm glad and I respect people that came today to honor us, and they can see that, no, it's quite good. Thanks for that.
What is the road ahead now? What is the way forward? Now you are the chairman. Earlier you are not, you are just upcoming chairman, but right now you are the chairman. What is the way forward now?
Yeah. Like I said before, I'm not saddled. I have the broom with me, I have the flag. I've been given the task. I've been given the power. Then I need to use it in such a way that it benefits mankind. It benefits humanity. It benefits APC members and by extension, Nigerians. The Nigerians and the APC members in Mpumalanga should be able to feel that there's a different and there's new king in town where they can run to in terms of welfare, in terms.
All right, everyone. Thank you for joining us. We really appreciate your time. It's a good time. I really appreciate those of you connecting already. Kindly keep sharing it, keep talking about it. You know, every Wednesday we come on your way to make sure that we put the Dr. Ademola Tosin Ojo Dato on the spotlight. Remember, this is a health talk on the African Portal Radio. And why this program is important is because to let you understand how you can be able to take care of yourself against some of the sicknesses and diseases that is around, and also is also to sensitize the community, to give you the first information, and also to enlighten the community. And this is fully paid for by Dr. Ademola Ojo. And why we are having this is because we need to talk to our people to always go for checkup. We work very hard, day, night, morning, evening, Monday to Sunday, working. Do you have time to exercise? That is the question we are throwing back to you. Last week we talked about the heart attack, and doctor also suggests to the government to at least have a recreation center in some of the area, especially in Nigeria, because you will realize that a lot of environment, there's no place where you can go to relax or to do exercise. And that is the recommendation that come out of that program last week. And it's already gone viral. If you go and check some of the national newspaper in Nigeria, it's already out there on the newspaper and it's gaining momentum. So if you go to Happy People magazine is there. If you also go to Parrot magazine is there. And if you go to national newspaper like Daily Independence, it's already there as well. And also New Age already also publishes. It's going viral. So you can go and pick up those newspaper. You will get what Dr. Ojo advised the government and the community as well to do in order for them to look after themselves, because health is actually wealth. You can make all the money, but if the health is not there, it's a very bad thing. So as you are making money, also look after your health. As a matter of fact, health is very, very important, because it's the first thing. When you have the health, then you can enjoy the money. And I pray that whenever the money comes, your health will not disappoint you. Join us today as we are going to be unpacked and bringing you another segment of this program. Today, we're going to be talking about the kidney. What are the diseases? What are the problems? How can you protect your kidneys against some sickness? Or how can you live a healthy life? This will be one of the things that will be getting momentum on the African Portal Radio. I have the able hand in the house joining us. You know, remember I told you this is going to be 13 weeks. So we just covered the 3 weeks. The first day, which is the first one, was actually preamble. We just laid the foundation. Last week was another very big and very lovely one. This week is going to be another one. So every week is getting better and better and better again. Thank you for joining us. And this is African Portal. Join me to welcome the community leader that's doing well, always believing in humanity, doing the work that everyone sent him to come and do on health, always supportive, always believing, always working hard, and always making sure that everyone live healthy life. And that is Dr. Ademola Ojo. Dr. Ademola Ojo, I'm really happy and I'm so excited to have you back on this program this week. Thank you for joining us again. How are you this evening?
Thank you, my bro. Good afternoon, and good afternoon to our listeners. I'm glad to be here again for another round of Health Talk, and I'm sure people are benefiting from it. We are here to do our best. We always do that, as the our producer there have said that it's for 13 weeks. I've just started. There's a lot to give, so we'll do.
All right, everyone. So get your paper, get your pen, sit glued to this program. In case if you miss it, you can watch it on our TikTok, and also is available on our YouTube and also on our Facebook. All social media, you can get us there. Go and watch it and share it. And at the same time, you can get it on www.Ademola website as well. You can go to the website, Ditto website as well. You can get it there as well. I'm going to put that information on the space. You can also get all this program there, and all the publication coming out from the newspaper. You can as well get it on the website as well. And at the same time, you can go to Dato website, and also you can go to Dato social media on Facebook and also on other social media platform. The media guys are doing a great job, and I give kudos to them. Keep the ball rolling. The sky is the starting point. It's no longer the limit. So let's get to the business of the day. Doctor, once again, I really appreciate you out of your busy schedule giving us this time to have this conversation, sensitize the community, enlighten the people, and let the people know about their health. Kidney is one of the very important part of our body, and a lot of people are suffering from different diseases all here and there, and they don't even know. Many people don't even do checkup for them to know. So that will be what we are going to be talking about today. Sir, let me allow you to give us the introduction. The kidney, what is the event? I mean, when we are talking about the kidney in our body, where is it? Because some people don't even know where the kidney is. Where can we get this? And why is it important that we need to have a healthy kidney?
Yeah, good day. And once again, good afternoon to all the listeners all over the world. We need to start by appreciating what these kidneys are. They are two bean-shaped, vital organs in the body that are located at the upper back part of the abdomen. The upper part of the abdomen is where it is referred to as retroperitoneum anatomically. That means the position is, behind the retroperitoneum at the upper back of the abdomen. It's not what you can easily see even when you open the abdomen, because it's covered by the peritoneum that's behind it, which is the one that covers the intestine. And like we said, there are two vital organs on each side of the body. The right one is slightly lower than the left, and that's not a problem. It's anatomically positioned as such. And when we say vital, I think it underscores a lot of points. That means it carries out a lot of functions in the body, because primarily it filters out debris, excessive, unwarranted products, and excessive water from the blood. These unwanted products, if left in the body, can cause problems. And apart from this, it can also do other functions which are very, very pertinent in the body. One of these is regulation of the blood pressure. And by filtering the unwanted products in the body, it regulates the electrolyte in the body, causes electrolyte balance, which is known as hemostasis. It functions by making some blood products or some hormones known as erythropoietin that can assist in blood formation, and also in bones health, because it's involved in vitamin D synthesis. So when we say a particular organ does these functions, it's straightforward to go along just a stretch by saying if these functions are affected, definitely the body will be at the brunt. It will affect the body. And this will be leads to either acute, if it's immediate, or chronic, because most of it will start slowly and it becomes chronic. And having a chronic disease can make it feel as if one's life has spun out of control. But knowledge really is power. We need to get this out. This is what we need to get from this discussion today. Knowledge is power. Because the thing we're worried about when we don't know what to expect can be far worse than what may really happen. So learning about your kidney is a way to feel more in control of your life and your health. And today, we're going to dissect explicitly to unravel the mystery behind the disease called kidney disease. Please listen, stay tuned. Let's continue.
All right, thank you very much. That's a very good one, and I really appreciate you. Please glue to your phone or to your laptop or wherever you are watching out for, glue to your device. Let's have a great time. Doctor just mentioned something that's the more knowledge you have about your kidney, the more you are in control of your life. So that means this program is very, very important. Doctor, let's get to the business of the day. Let's break it down and let's look at the why people often saying that they have kidney disease. It's very expensive to fix. What causes all this problem? And is this something that somebody contact, or is it as a result of negligence? Maybe you don't drink enough water. Maybe there are some certain chemical you are taking. Some people they say they cannot go to toilet if they don't smoke something else and all that. What are the things that cause this problem?
Yeah, thank you, moderator. Here it could be classified into two, but the major causes are acquired over the time because of what we do, or because of what happens to our body, or because of what we eat, or because of the type of work we do or we engage in. And others maybe like congenital. That is, we are born with it. Those ones that will be born with it will be directly involve the kidney itself, abnormalities of the kidney, renal artery stenosis, polycystic kidney disease, or horseshoe-shaped kidneys. Those ones can be fixed anatomically, by surgery. But the commonest causes are those that are acquired. People that are born with good and normal functioning kidneys, and over the time start deteriorating. And one of the commonest causes is high blood pressure, uncontrolled high blood pressure. You have high blood pressure. These are part of what we discussed last week. Because you may not know, regular checkup is one of the major reasons why we should do that. You do your regular checkup, you detect you are having high blood pressure, then you get medication. If it's well controlled, you are less likely to have kidney damage. Another one is diabetic mellitus, which is excess sugar in the body, because this affects the nephrons and the glomeruli of the kidney, which can lead to deterioration from 100% functionality to less than 15%. And kidney is so resilient in such that over 85% of it must have been destroyed while you are still living healthy life without knowing. So it is very important to pay attention to this topic, learn from it, and know what to do at the right time. Other problems could be recurrent kidney infections. You have infections, either STIs, sexually transmitted, or otherwise, and if you don't seek medical attention, that can lead to kidney disease. Part of it is, recurrent urinary tract infection. Others may develop stone because of lack of adequate intake of water, or excess of food that is rich in uric acid that may be stored in the body. And then use of painkillers, unauthorized, unprescribed painkillers. We call them NSAIDs. That's non-steroidal anti-inflammatory disease. The commonest of it is ibuprofen, which is easily prescribed, can be bought over the counter, could be bought over the counter. So we need to pay attention to all these things. People do smoke, as the moderator said, you smoke before you do this, you smoke before you do that. and excessive alcohol intake. That is that is not encouraged. Then obesity, because that is part of what we discussed before. You need to maintain regular, healthy weight, regular exercise to keep your weight in check. So obesity is one of the causes, and others, as what I've mentioned, like congenital, which is from birth. Those are the salient ones.
All right, sir. Thank you very much for that enlightenment. And some question will be coming in later in the program. We're going to open the line for people to call in as well. People may have questions, or some people may need to know more about this. What are the signs that one can be having in the body that will show that truly you are having a kidney problem?
Look, there are so many signs. Some are peculiar, some are not. But once the kidney is getting damaged, few signs will come up. And this vary from swelling of the body. Because as we said, one of the basic functions is to excrete excess waste products and excess water from the body. So if the kidney cannot perform this function, definitely this fluid or water will be retained in the body. And the first time you start seeing is swelling of either the face, the leg, the ankle, or the feet. Then frequent or reduced urination. If the body is not able to filter those water, definitely you won't be able to pass them out. Then there could be blood. If the glomerular of the kidney or the cortex is involved, you start having blood in urine. Then typically, once this glomerular, which is the small cells in the kidney that is involved in the filtration of excess and unwanted product in the body, once they are damaged, the ability to filter, to restrict the excretion of protein is lost. Then more proteins will come out of urine, because ordinarily in a 24-hour urine, if you pass urine and put it in a box over 24-hour period, it's not supposed to be in a normal settings, not supposed to be more than 150 grams per day. But once kidney disease starts, you start having excess protein in the urine. And when you pee, definitely in a toilet, especially WC, you see foams. That's a red sign. Others, you start getting tired, you start getting weak, inability to take in food, appetite is lost, nausea, vomiting. Definitely, once the kidney is not able to filter those products and it accumulates in the body, it affects the brain. Concentration, dizziness, tiredness. Somehow, there could be high blood pressure, which may be what has already caused the kidney damage. So you need to look into that. Maybe be very high and may be difficult to control. You may be having shortness of breath because water is retained in the lungs. It reduces ventilation. Then these are the things you need to think about. Those are the common signs. Yeah.
All right. Thank you very much, sir. I like the way you put it, because you make it simple for us to understand all these signs. But when someone starts having this sign, is this a dead end, or is there any solution to that? Let's say, for instance, now somebody is, when it's passing urine, blood is coming out. Does that mean that this have gone to a high level that is unrepairable, or there's something that can still be done if somebody is having such signs in his body?
Yeah, good. A lot can be done, because the person needs to go to the clinic where the basic tests could be done, or hospital. If it's clinic, the first thing they will do is to check the urine. They want to know those things that are coming out of urine, because on an average settings, you want to check if the protein is there, if sugar is there, which is not supposed to be so. Even if it's protein, if it is trace, we regarded it as less than 150 milligram per day, which is okay. Blood, is it 1 or 2 pluses? You need to categorize it, and you need to check For other substances like nitrate or epithelial cells, nitrate may signify some level of infection. Epithelial cells may be excessive shedding or due to kidney disease, but most times may be part of shedding, which is fairly okay. But those are the things to put together, because if the urine is checked with the dipsys, as we normally call it, and there is excess sugar, definitely that's diabetes. But further steps needs to be taken so that this, either protein in urine, sugar in urine, nitrite, you can go further by doing blood tests, where you need to classify the sugar in terms of the level of diabetes. Is it type 1 or type 2? Will it need insulin? Will it need treatment? Or will it need just lifestyle modification? Even in the protein, you want to so see, because when you do the urine dipsticks, it may not be that accurate, but that's giving you a level of sense that something needs to be done. Then you refer the person, blood tests will classify, because they can do 24-hour urine protein. And from there, you can classify if the person is under normal, because, or moderate, or mild, which is between moderate or mild, which is between 150 to 500. More than 500 is excessive, it's abnormal. Then those classification needs to be done. And further investigations that will need to be done will be imaging. You want to do the ultrasound or do CT scan to see if the kidney is really compromised. And part of the blood test is to do, glomerular filtration, because that will show if the EGFR is going down or going up, because that classifies kidneys into 5 different stages of kidney diseases. Is it less than 85%, or between 65 to 55, or between 35 to this, or less than 50%, because that is severe. And those classification needs to be done. First, there are certain medications by the physician to start with to treat the patient. If it's diabetics, you control it. There could be improvement in the kidney. If it is blood pressure, you control it. That could bring improvement. Others may need to go for dialysis if it is far ahead. And the last lap of it is kidney transplant, depending on the stage. But everybody will qualify for different stages of treatment. Thank you.
All right, sir. Thank you very much. One of the message we put down here, according to our research, say that how to prevent kidney diseases, control your blood pressure. They say keep your blood sugar under control if you have diabetes. Drink enough clean water daily. Eat a balanced diet. I think we mentioned that also last week. Eat a balanced diet, low in salt and processed food. Also, it's like exercise regular and maintain a healthy weight. That is another information we got. So they say avoid smoking and limit alcohol intake. Is also one. There's a treat urine tract infection. That is, maybe you have a urine infection or treat it properly. So they say go for regular medical checkup. That is the area I want us to now look into. Go for regular checkup. Sir, we living in a society, especially in Africa, where people find it difficult, especially they say, no, medication is very expensive. Going to hospital is very expensive, especially in a country where there is amber. People cannot go to the public hospital because they are foreigners, and also some places they cannot afford the private hospital. What are the recipe? What are the things that people can do within their own space that can help them before they now get to go to doctor?
I think those are part of what you've mentioned, because if we look critically into the causes of these kidney problems, if you take it one after the other, the solution is quite explicit. You have high blood pressure, you control it. But the bottom line is regular medical checkup. Because if you don't do regular medical checkup, you won't detect most of all these things. Others are lifestyle modification. As you've alluded to, regular exercise, low intake of salt or processed food, avoid smoking, alcohol, treat timelessly urinary tract infection, and If you have blood pressure, you have to treat it rigorously. And that is a function of regular medical checkup. So also is diabetes, because those are the major causes of chronic kidney diseases. And then we talk about medication. You stick to the medication you are given by your doctor. You don't go over the counter and start using excessive pain medication, because those will be silently damaging your kidney. And like I said, this kidney is very, very resilient. By the time it starts, because the stage 1 of this disease is when you have the kidney disease of about 90%. It goes to stage 2 if it gets to about 60%. It goes to stage 3 when it's almost 30%. Then when you are in stage 4, it's about close to 50%. Less than 50% is stage 5, and that is the highest grade where you start seeing major problems. By then, almost 85% of the kidney is gone. So if you don't put all this preventive measure into place, you may not know when more than 85% of the kidney is gone. So regular medical checkup is the cornerstone for this type of disease. Thank you.
Thank you, sir. Is this have age age limits? Possibly, maybe because maybe you are between 40 upward, you start having, or is this something that doesn't matter the age? Does it have to do with age?
Definitely, everything in the body goes with age, because even brain will still age. You start having dementia, Alzheimer's, or all those things. It's a function of age. Then kidney will always age, but even at 90, most of the function can still be restored if you follow all this preventive measure. But age too is due to the exposure of the body to so many things. Because if you are older, likely you may have hypertension that will be controlling for long. There's likely you have diabetes, you'll be controlling for long. It's likely you may have you may be taking pain medication for arthritis, for joint pains, for any other ailments that you've been diagnosed with or that you are treating. And it's likely you might have taken other medication either for skin disease or for any other ailment that may have, to some extent, affected the kidney. Because with age, you've exposed more to all those things than others. So it's still a function of age, but most people will still do well in old age if they are able to control and minimize excesses of what can cause kidney disease.
Earlier during this program, you mentioned that taking some body pain relief and all that, in essence, can also be one of the things. Can you please elaborate that a bit? Because a lot of people think that I'm having pain here. Buy Fensic, buy Panadol, buy just mixture. They took it. What are the dangers that is in this? But before that, sir, let me quickly check who is on the line. Let's quickly open the line and see who is on the line. Thank you for connecting with us. This is a talk on the African Portal Radio TV. Who is on the line? Hello, you are already live.
Good afternoon, African Portal.
Thank you for joining us.
I am happy people from Nigeria.
Okay.
Doctor, well done, sir. We really appreciate what you are doing for us, because the last week edition was superb and we really gained a lot. And I know this week we are going to gain a lot. My question, sir, about the body pain and issues that we are talking about, what can actually cause it, and does we have to get medicine immediately we are feeling a body pain, or is there kind of certain exercise we should engage into? Because the last week we talked, you emphasized more about I've been doing exercise and stuff like that. So please elaborate on it, sir. Should we use more of medicine, or we should engage more in exercise? Because many people are complaining about body pain, especially in this part of the country that I am in, Nigeria.
All right. Thank you very much. That's another very good point. Thank you so much. Doctor, the question is that a lot of people are believing that, okay, they have body pains. Is there any other way, not as a result of exercise, but they are feeling pains maybe in some part of their body? And I mean, what do we need to do? Do we need to, instead of, do we need to just buy the drug and take the drug for the pain relief, or do we need to go and see the doctor and complain to the doctor? And exercise that you mentioned, let's say people embark on exercise, maybe jogging for the first time, they start have body pain as a result of the exercise. Do we need to take some pain relief? Can you please elaborate that a little bit?
Thanks for that question. Quite important. And I'll go into it and dissect as fairly as possible. This is how it should be. Everybody knows that being fit is a function of regular and moderate exercises when one needs to be fit. You see some people with big tummies, just because of sedentary life, no exercise at all. So it has to start from somewhere. Rome is not built in a day. If you're not the type that is used to regular exercise, you can't just start jumping up and down. No, your body will not be okay. So you need to start gradually. Let's hypothetically, you've never exercised before and you need to start. You need to start with just walking, possibly for a week or two. You can increase the pace at which you walk, which we call brisk walking. Let the tone of your muscles start getting adjusted, start getting into shape, and start changing to fit in to the enormous rigor that is about to be subjected to. Now, once we are done with that, there could be minor pains. Everybody feels pain here and there, but not every pain you need to take medication for. Then you can now advance, start slow jogging. That may just be 5 minutes or 10 minutes over a kilometer, and you relax, because your muscles can go into spasm because of increased secretion of lactic acid, because the muscles are not used to it. Because during exercise, the muscle uses glucose. And then, if the glucose is exhausted, if you do so much, the glucose may be exhausted, bringing in other products, food products like fats and protein into energy production, which is called gluconeogenesis. And that will produce more of lactic acid, because the oxygen may not be enough. You breathe in when you are exercising, may not be enough to dissolve those acid, and may lead to accumulation of lactic acid, which is literally called muscle pull. So it needs to be done gradually. So, and that is what we talked about the last time. Regular, moderate exercises. It doesn't need to be rigorous. And once your body is used to that, then you can have a framework. 30 minutes, 2 or 3 times a week is just enough. You are not going for Olympic. You are not going for marathon. That is the way to put your body in good fitness. And once you are used to this, it is more of medicine. It's more medicinal than taking any pain medication. By the time you go to work, you come back, you hit the gym. Even if you don't have gym, it's not an excuse. You can do that anywhere around, either your house or your street or anywhere that is safe, where you'll not be exposed to any motor vehicle or pedestrian accident. So that is what you do. So it's very important that people can be encouraged. People have done it in group before. They join a group, a gym group, where they can encourage themselves, and they start gradually. Before you know, most of those people that have been using so many medications before start casting them out. It's not longer necessary because your body is fit. What you do before you start feeling pain, you don't feel pain anymore. It lowers cholesterol, it lowers blood pressure, it improves the tone of your blood vessels, it improves circulations to the brain, improves concentration, improves your agility and mental focus, even cognition, super. So these are the things you gain from it without medication. Now, in terms of medication, Panadol, most people will abuse it, and there's other medications that people will, bring over the counter. You don't even know the source, you don't even know how it's made, but the culprit is what is called non-steroidal. We call it non-steroidal anti-inflammatory drug. The commonest is ibuprofen. Everybody knows that. What it does to the kidney it causes interstitial nephritis. It damages the nephrons of the kidney, which are the main pillars of filtration. So gradually, it does that arm over a period of time because there are so many. And that's why the percentage of the functionality of the kidney reduces over time. So these are the things to take into consideration. Thank you, my brother.
Thank you very much. And thank you for calling. I really appreciate it all the way from Nigeria calling. We hope on the line and we are going to get more calls. And we know that the time is running very fast and we have just few minutes to round up this section for this week. We're coming back with a new topic next week. But before that, sir, we're living in a generation where people use a lot of energy drinks. When it comes to I need to walk overnight, they take a lot of energy drinks. What are the advantage of this and what damage this may do to our kidney?
Yeah, a lot of energy drinks. The major problem with energy drinks is some of the constituents are not that made known to so many, because these energy drinks are made of mostly of caffeine. Because the primary aim of caffeine is to prevent you from sleeping so that you can walk over a long period. And exhaustion is not the best for kidney. It's not friendly to kidney. You take in more caffeine, it increases your energy, it releases other new neurotransmitters from the muscles because you are exhausted, and those things affect the kidney. You don't sleep, you are exhausted, the brain is not functioning well, definitely. And all these products will pass through the kidney, affecting the nephrons. So moderation of it, maybe, but there are people that are chronic users and they are addicted to it. It's really discouraged. It's really discouraged. That's the message. Thank you.
All right, sir. Thank you very much. Or to those of you that believe that I'm working very hard, I need some energy drinks. Let me take some energy drinks. And some people even use it for fashion. They will hold the energy drinks in their hands for people to see they are drinking the energy drinks. Take it easy on yourself. It's also damaging your kidney. This is a sensational program to sensitize our community and to let you live a healthy life. And it's fully support and sponsored by Dr. Ademola Tosin Ojo Dato. And that is why we always see him on this program every Wednesday, 5 o'clock from 5 to 5:30. Sorry that we a bit late this week. That have to do with so many things that is going on in the studio and other things that needs to be done. But let me be honest to you. We are going to be here for another 10. We have about 10 weeks to go on different topics, different issues they have to do. And if you also have some issues, some problems that you want doctors to attend to, or you are going through, or you have some chronic diseases and you need help, you can as well connect to Dr. Ademola Ojo Tosin as well, because he's always there to also help you. Based in Pumalanga, is also one of the great doctor in our community, and this have nothing to do with your nationality. It doesn't matter where you come from. They'll be able to assist and also help you. But remember, it's not for free. You have to pay for the service. So don't say the African portal have said that we should come to you, you will treat us free of charge. No, there's no such thing. So please look after yourself, do check up, and always drink water. Not too much of water, because too much of everything also is also not good. So drink water, do exercise. Like doctor already break it down. Don't just jump into gym or start running without even you trying it before. I want to lose weight, and you are doing it as if that you are going to lose that weight immediately. Take it easy on yourself. Take it step by step. Relax. Do it. Starts from the lower ground to the higher ground, and that is how to do it. Doctor, thank you very much once again for coming out. A lot of people are listening to us and are joining us. Earlier before in the program, I mentioned that we have your website and also we have all your social media, and I'm going to post that as well on this program for people to get in touch with you. And everybody, please go and follow Doctor on all social media. That is Dato, because great thing is about to happen in the continent Africa. This great leader have a lot of projects coming up to make sure that Africa get to their right position. And that is one of the excitement that we have in this house, that we have a leader that care about the masses, that also care about the community. So let's do it together. Before I let you go, in conclusion, what is your medical advice to our listeners at home?
Yeah. I think it's good to note that in this day and age, we cannot feign ignorance of what kidney disease is all about. And if we have been living in that illusion before, at least this exercise today has done a bit of justice to what is really paramount and quite expedient to this particular kidney disease. And on this note, we need to say it will be good to have moderate regular exercise, regular medical checkup, check your blood pressure, check your blood sugar, drink enough water, eat balanced diet. Even if you need to consult a dietitian, it's good. Avoid self-medication. Visit your healthcare provider regularly. That is the cornerstone. And like I said before in the opening address, knowledge really is power. Hold on to it. Don't lose it. Thank you.
All right, everyone. Thank you very much. As you are listening to us, you just go to Dato. That is DATO. That is Dr. Ademola Tosin Ojo. You can Google it. You can search it on all social media. Do that right now. Like it, because at the end of this program, there is going to be a special program where we are going to do a giveaway. And that have to do with those people that is following this program. So if you have been following this program for the 13 weeks, something special is on the way for you. On the last week or on the 14th week, there will be a giveaway. And that giveaway will only go for those that have been following us, that have been reading our newspaper, checking what we are talking about health and all that. And to those of you that you are joining us across the globe, this is African Portal Radio TV International. We're putting this together to help you live a good life and also healthy life. Exercise, drink water, rest, sleep. Have at least 7 to 8 hours of sleep in a day. Some people will say, no, just see me. It's until when we die, that is where we rest. There is still such thing. Rest. Take time to rest. Just see you, because you don't even know what we happen. We don't even know what we happen after when we die. Don't have that illusion that just see me. Possibly when you die is when you start walking.
That's a serious one, eh?
All right. Thank you very much, everyone. So keep watching this program. This is another edition for this week. We are coming back next week, and it's going to be another beautiful time. This week, we're talking about your kidney. Look after yourself. Take care of yourself. Rest, drink water, exercise, and do all that. Doctor, thank you very much for your time and for the advice. A lot of people will believe that, they will be following your social media and all that. And also, this program is going to go viral on some of the national newspaper, especially in Nigeria, and also online newspaper. So when you see any of these posts, like it, read it, also share it, and tell somebody about Dato. Dato is about to take over the space. Watch out for it. It's going to be a great one. Thank you for joining us. Thank you, Doctor. I know you're very busy. Let me just allow you to go, and we will bring you back next week. God bless you. Thank you for your time.
Thank you.
Bye for
Bye.
Now. All right. Thank you, everyone, joining us. We really appreciate it. That is Dr. Ademola Tosin Ojo Dato on the African Portal Radio TV International. We are having a good time together talking about your kidney this week. Next week, we are going to be having different topic that we are going to be unpacked on this program. But kindly watch, share, like. Remember, on the last week of this program, we are going to do a special giveaway. And the giveaway is for those people that have been following us, watching us, and following the topic that we are talking about. So always write each and every week down. I'm giving you the secret of the exam now, because on that last day, we're going to throw the question, what happened on the first which topic we treat on the first, second. So get ready for it. Please join this program. Tell somebody to tell somebody to tell somebody to go and follow Dr. Ademola Tosin Ojo Dato. Go and follow him on all social media. Check it out on all social media. Don't forget, just go to your social media and search for Dr. Ademola Tosin Ojo Dato. Follow him and you will learn a lot from that space. God bless you. We also have the website as well, which we are going to post later on the program. And as we are rounding up this section, I'm coming back next week. It's going to be a great time. It's going to be another beautiful time on the African Portal Radio TV International. Don't forget that Africa is our business, and that is what we promote. We believe in Africa. The unity of Africa is paramount. There's no doubt about that. If we come together as a continent, as people, and we work together, we will be able to achieve the greatness. And this continent, it's long overdue. We've been behind for so many times. A lot of people have come in and out of this continent, taking a lot of things from this Africa, taking it to the other side, making it more important and more valuable, and bring it back and sell it to us. It's time for us to wake up to the reality of time. Smell the coffee, Africa. You can do better than what you are doing now. Unite, unite, unite. Unite Africa. Bob Marley talk about it. Many leaders talk about it. Mandela's month, Mandela also talk about it. He said, it's in your hand now. And it's in our hand, really. It's in your hands to make this place a better place for everyone. I remember Mandela also say, education is the tool that can take you out of poverty. And that is exactly what this program is all about. To educate you, to sensitize you, and also to let you know how you can live a healthy life. Watch this program. Share it. Tell somebody to share it. My name is Dari Oluso. Keep watching, keep sharing, keep talking about it. God bless you. Have a great evening. Bye for now.
And we can provide, a helping hand, and we can provide that shoulders for them they can cry on to. And at the same time, we want to portray Nigerians in Mpumalanga in a positive light. We want to take out the negative image that Nigerians have had over the years, especially in Mpumalanga. We want them to know that there's a new sheriff in town who is here to rub minds with every person in Mpumalanga, so that when we chart a new course, we have a direction and we can be able to beat our chest and say we have really delivered. And that is the task ahead.
All right, thank you very much, Honorable Dr. Ojo. Congratulations for your new office, and we believe that it's going to be a very smooth one. Thank you very much, the African Portal. We congratulate you, and we believe this is the beginning of beginning. Congratulations once again. Thank you for your time.
Thanks so much for you guys standing by us. We appreciate it.
Everyone, thank you very much. That is the chairman of the APC Mpumalanga, and he's telling us that the job has started and is ready for action, and we look forward to it. We need to cooperate, we need to support, and we need to be part of this. Those of you on this fence, come out of the fence. Let's do it together. Together we can build a better community, especially Nigeria in South Africa. Thank you, and God bless you. All right, everyone.